Okay, so here's a question. Have you ever struggled with following up with commitments with like people? For example, um, everyone's all excited to go to a certain party, and you just find yourself kind of like, um, I do want to go, I just can't make myself go. It's not necessarily like an anxiety, it's kind of like, I just really don't want to see you guys. But in the back of your head, you do. It's a very confusing state to be in. Um, and I just wanted to talk a little bit about avoidant personality disorder. So basically, I talked to a psychiatrist last week, and I went through like all of my symptoms. I knew that I had ADHD, and I was diagnosed with that. I did take two assessments, and I was diagnosed ADHD. I knew from a young age that that was most likely. However, I never really thought of anything of avoidant personality disorder. In fact, I hadn't even heard of it ever. Um, and if you look up like resources for it, there are some, and there are some people that still think it's like fake or just uh, regular anxiety. Um, but I'll give you guys like an example of something that I definitely have felt my whole life, and it sucks. Um, One, for example, is um, I have I make friends pretty easily at work, and I love these friends. And specifically, I had two friends at my last job that I respect so much, and I think the world of them. I think they're amazing people. Um, and we did hang out while we I lived in Miami. But then when I moved for a new job, they still reached out. They still tried to talk to me. They still, would say, "How are you guys? How are you doing, Fernando? I'm just checking in." And I just wouldn't message them back. I don't know why. I love them. I think about them all the time, and I always think about texting them. And then every day that I don't text them, I feel more ashamed that I haven't texted them back yet or that I haven't messaged them. And then I tell myself, okay, I'm going to message them because they deserve respect. And I feel like it's pretty disrespectful to just leave them on red when, they are very good friends of mine. Um, but I don't treat them that way. And so that is like one of the symptoms, or that's something that avoidant personalities, people that have it, that's something that they go through. Um, it can come from a variety of different places. The most common is childhood trauma, uh, where you're left in a situation where you're you felt unseen, or there could be abuse. Um, in my experience, I do remember there being, some sad experiences in my family where my parents would be fighting, and the fights would get pretty bad. And I remember being, I don't know, 8 years old and kind of living in maybe a fantasy world to escape from that pain. Um, but I remember my dad leaving the house, and my mom would just be crying there. She would just be crying at the kitchen table. And I knew, like, in the back of my head, like, I need to be there for her. I need to go down there as an 8-year old and just like console her. That's my responsibility as her child. She needs me. And I just did nothing. I couldn't react. I was frozen. A lot of it was because I wanted to be with my dad because my dad treated me amazing. I was his golden child. And my mom, she treated my sisters amazing and not me. So I just didn't go and help her out. It's very unfortunate that I did that, and that I felt that way, and I still blame myself to this day. But that's something that people with avoidant personality do. They're scared of confrontation, not scared of it, but they just don't want to deal with it. Um, and I have dealt with calling out sick from work when I'm not actually sick, just because I don't want to deal with a certain um, thing at work. And so, yeah, these are very tough symptoms to have, and it's it's not a very well known about kind of mental disorder, I guess you could say. So I'm just going to read this definition. And it says avoidant personality disorder involves the constant fear of rejection due to thinking oneself inferior to others. And that's a big part of it is that people that have this, um, they might not show it from the outside that they have a low self-esteem or self-worth, but they really do. And it manifests itself in times where you are avoiding. It says a negative concept of self and deep-seated fear commonly result in social avoidance, making it nearly impossible for them to form personal relationships. And that's exactly true. I mean, in my experience, that's really what I've done a lot of my life. I get very close to being close to a lot of friends. As soon as they want to start hanging out all the time, they start inviting me certain places. I have an excuse as to not to do it. There is a difference between wanting to, chill and watch Netflix instead of hang out with friends, or I've heard of that before, cancel plans because you just don't feel like it, um, or you have other things to do and you don't want to disappoint your friends, so you make up an excuse. This isn't that. This is intense feeling of wanting to do something and just not being able to, being frozen and that, and then feeling guilty, frankly, for leaving that friend, uh, feeling not wanted as a friend when all you want is to show appreciation to that friend and you have issues with it. Um, Another thing is that it can leave you isolated. So, of course, when you avoid people and you avoid certain situations and confrontation, that is going to leave you isolated. And so, avoidant personality disorder could lead to depression. And so, these are the types of things that you really want to, of course, avoid. I'm going to read a couple other, symptoms or signs that someone might have it. Uh, Poor eye contact, emotional avoidance, reluctance to talk about themselves, people-pleasing tendencies, of course, difficulty trusting others, and like I said, a lot of these things do not necessarily show. So you won't actually see someone have difficulty trusting others that has avoidant personality disorder because of several masking techniques that they may use that they've, to adapt several coping mechanisms that they may have. Um, Big one is timidity. In my life, this manifests that I was in the Marines and I had a lot of success because I am really good at not speaking when I'm not spoken to. Um, and when I am spoken to, I'm really good. I do well. But when it comes to talking to people that were higher ranks than me, um, I just wasn't able to. I didn't really want to talk to them. I avoided them at all costs. I saw people that were my same rank talk to people that were higher ranks and get along with them really well. And I just kept that professional relationship where we only talked about business. Even if they tried to get close to me, I just was unable to. I wasn't really sure. I was too timid um, when they were in that role. And then uh, hypersensitivity to others' emotions. So that's one of the signs of trauma as well, because you're always in survival mode. So you're always trying to gauge, you know, where's your bipolar mom at right now? What is she feeling? Is she sad? Is she mad? And you have to dissect those things when you're a child, leading to a lot of uh, hypervigilance as an adult. And that can manifest itself in a bad way. For example, I might look at my wife, um, and she's just in deep focus mode of working, but I see a serious face and I think, oh my gosh, what did I do wrong? Um, I have to start people pleasing now. I have to start, doing an act of service for her in order to get back on her good side. Um, and then I go the whole day thinking that I did something. Meanwhile, she was just having a serious face because she was working. And so that does cause some stress and some tension in your relationships. Um, and so the best ways to treat this, obviously therapy, talk therapy, psychotherapy, definitely get psychological treatment and speak to a licensed professional. Um, I'm going through, some work. Um, I've watched a lot of YouTube videos. I'm reading a lot of other people's experiences that have dealt with this. But like I said, besides a couple of papers like from the National Institute of Health and things like that, the resources on this are not as much as a lot of other mental disorders or personality disorders. But I did want to tell you if you suffer from these types of signs and symptoms, or you know that you have this, just know that you're not alone. Um, I have it. I am not using it as a crutch. I'm not using it as something that, you need to treat me specially because I have this, but it is extremely important to identify when you have these types of issues so you can work on them. Um, there's physical therapy if you break a bone or if you tear a ligament or something like that. Um, but mental therapy is, you know, the exact same way. If you really want to get on your feet, if you really want to get, back to the same physical condition, you do physical therapy. If you want to get, back as as much as you can to a more normal state, then yeah, talk therapy really helps. CBT, of course, and um, I'd like to hear what everyone else is using to try to feel as normal as they can. Because um, when you do go through these traumas as a child or as an adult, even, um, there is a lot that comes with that. And you may feel like things aren't fair, but there are a lot of resources out here for you. And I'm going through it myself as well. So, yeah, just wanted to give you guys a quick rundown on avoidant personality disorder. Um, I know I don't get many views, but I do want there to be more people telling their stories that have it. And yeah, so just hopefully you like this video. And if you want any more on the same topic or another topic, just let me know.